Okay, stay true to my word. It's 1 o'clock. We're going to start on time since we only have an hour together today. So thank you for joining us for today's webinar um, titled The Deep Dive into Intensive Technical Assistance. We are going to share with you a little bit more information about what the National Center can do in collaboration with you and your state, tribe, or territory. So I'm going to hand it off to my colleague, Michelle.
Hi, I'm Michelle Savieo. I am the Director of Technical Assistance with the National Center for Adoption Competent Services. And I will be sharing information today with my colleagues. You met Erin and also Sean Snyder from the Baker Center for Children and Michelle Seymore from the National Adoption Association. And so we'll be passing back and forth as we do this webinar. But today, what we would like you to do is just to learn more about the National Center, its mission and why we came into existence and how we can come up with solutions to meet systems professionals and needs, what we are doing for technical assistance, and hopefully you'll be able to consider how we might be able to support to your agencies as we move forward. Some objectives that we want to talk about today are adoption competence, how we can partner with youth and families to transform systems, making sure that we're offering services with a racial and broader equity lens, technical assistance in our evaluation process. So, Erin, can you move forward, or can I just move the slides? So why is the National Center in existence? The National Center was started through the Administration of Children and Families, and it really is to look at systems of child welfare and mental health and how we're meeting the mental health needs of children, youth, and families who have been impacted by child welfare. We know that these youth can often have lasting physical and emotional scars, and which can lead to other disorders throughout their lives. We also know that children of color and children from Native American tribes are overrepresented in the child welfare system. So what we do is we envision a world where all children and families that have been impacted by the child welfare system are able to reach their full potential because we're meeting their needs as they arise. We envision a system where change makers within child welfare systems are able to collaborate to advance the work and then sustain adoption competency throughout the duration of time. And then we want to partner to build culturally and linguistically accessible mental health services so that they're available for all people and are able to uniquely meet the needs of children and families who have experienced a child welfare system. So what is technical assistance for? Through our technical assistance, we have 5 key outcomes have been identified. Increased collaboration. We know that oftentimes child welfare and mental health systems aren't on the same alignment. And so we want to help build bridges and alliance between those systems so that we're working in collaboration to meet the needs of children and families. We also know the adoption competency training is a state-of-the-art training that's available to improve adoption competency and child welfare competency of mental health practitioners. And we also want to see improved access to services. We know that nationwide access can be a problem for children and families to get mental health services. And so we want to partner with and figure out how to improve that accessibility and making sure that services are available to all. Throughout our whole technical assistance process, sustainability is one of our outcomes. Excuse me. We want to see that sustained collaboration, sustained use of training, and making sure that access continues for all children and families. And then ultimately, throughout all of these outcomes, The intent is to see improved well-being, stability, and permanency in the behavioral health of youth. We know that in today's society, there's a crisis, a mental health crisis among the youth, and we want to partner to achieve improved outcomes for them. So what can we bring you? One of the things that we are aligned to bring you is the National Training Curriculum of Adoption Competency Training. This training is evidence-informed. It's free, it's online, and it's available to everybody that works within child welfare, mental health, education, and not just child welfare, but any provider agency, any partner organization, even, after school programs that may be interacting with children. It really is, we want to spread the availability or the use of the NTI training to really be able to identify when children are experiencing attachment issues, loss, grief, ambiguous grief, and really build that network of adoption competent providers within our systems, and that they're able to understand the unique needs of children and families, and really have the confidence to work with this population of children. It could be really challenging to understand how to meet the needs of children when they are having attachment issues, because you experience that in all disciplines, not just at home. So this will help, this free training will help people come up with strategies for that. Through this training, there will be improved accessibility to make mental health service referrals, and really looking at, are we getting the right services, the right supports at the right time, so that, ultimately we want to see a decrease on the reliance of out-of-home care facilities, so that people, the parents, the guardians, are able to meet the needs of children. And then what we can also bring to you is tailored on-site technical assistance by a team of subject matter experts. The National Center for Adoption Competent Mental Health Services is comprised of 7 partner organizations, and they have specialties in child welfare, mental health services, the delivery of technical assistance, family perspectives, youth perspectives, racial and equity, diverse perspectives, but also evaluation. We bring our evaluators in to make sure that we're offering the services that we say we're going to offer. But most importantly, I want to share that this really is, our technical assistance is tailored around the needs of the state. And so there may be specific access needs, there may be specific needs regarding provider competency. And so all of our services that we offer are going to align with those that are in needs of the state or territory or tribe.
Okay, I think we're ready for a poll. Let me see if I can get it launched. Are you seeing the poll, Michelle?
Yes.
Okay, good. This is going to give us kind of a baseline as we go into talking more about adoption competence. So please take a second to respond. Okay, I'm gonna end it here in a few seconds. Don't want to cut somebody off, but it looks like it's slowed down enough. Oh, and it doesn't. So it looks like, oh, share results. There we go. And I clearly didn't title things right, but so it was how familiar you are with adoption. Are you with adoption competence? So kind of the lower numbers obviously is not at all or very little. And then as you get further down the list, they've completed adoption competent training. So it looks like we have some folks that have a good amount of knowledge about adoption competence. And for those of you that maybe aren't as familiar, we're going to share some information with you right now. So let me close that out and I'll hand it back to you, Michelle.
So adoption competence is really more than just adoption. And one of the things I want to share is that we have that there are 3 different training curriculums available that are designed for specific populations. There's a child welfare curriculum, which is really would be appropriate for those that are working within the child welfare system. It might be child welfare workers within the state or tribal system. It might be provider organizations. It might be judges or attorneys or guardian ad litems, residential care, treatment facilities, really anybody touching within the child welfare system. There's also a mental health training for clinicians. So for those clinicians who are doing assessment, diagnosing children, looking for the best treatments for children involved in child welfare, that really does provide a breadth of information available. And then there's also a school-based curriculum that is designed for those social workers or staff working within the school system that really is going to give an understanding of what it means to be adoption competent. But what I want to share is it's more than just adoption. The name came through because the training was the development of the training was funded through federal adoption monies, but it is applicable to a large group of children and families. Anyone who has experienced attachment issues, has experienced trauma, that are having issues such as loss, rejection, guilt, and grief. It helps people work with families to reframe behaviors and really to parent them from a therapeutic perspective, because they're able to understand where the child has been. And then, rather than asking what's wrong with you, we're going to ask what happened to you, because we want to understand that child's behaviors are symptoms of the experiences that they've had. We also know that healing is going to occur best within the context of a family, which makes it very important for families to be involved in treatment. And so this training shares information about that, provides foundational understandings. It helps people to recognize that family formation occurs not just by birth families, but with caregivers and adopted families, foster families, kinship families, that they really are able to form that family so that they can help that child heal. And then it also talks about the lifelong impact of trauma and the intergenerational impact that it can have. And so it provides a strong foundational understanding for people working with children and families that have been impacted in child welfare. And so as you think about this, and we really want people to understand that the adoption competent mental health services is really much broader and applicable to many people.
Hey, my name is Michelle. Oh,
I was
sorry.
just saying with that, I'll turn it to my colleague, Michelle Seymore.
That's a little quick to the draw, huh? Hi, my name is Michelle Seymore, and I would like to talk to you guys about partnering with youth and families to help transform systems. The National Center has been intentional about making sure that we have elevated the voice of lived experience and diverse communities who have traditionally not been heard of. We've really paid a lot of attention to making sure that we have elevated the voice of youth that have informed some of the methods and strategies to help address all of the needs that are within the community. Really making sure that we have youth perspective and that we are using youth to be a part of all of the critical decisions that need to be made, as well as informing policies. Creating an environment where lived experience voice is valued as much as professionals that don't have lived experience, and also incorporating the experience of youth in foster care, youth that have experienced adoption into all levels of our program development. This will really ensure that we are meeting the needs of the community and that we aren't causing harm. We're really leveraging the lived experience leaders on our team to be impactful advocates and to inform policy development, making sure that they are part of the process and that they are leading change within systems, child welfare, as well as mental health. Strengthening and advocating for policy development and making sure that those voices are elevated and that we're being heard. Creating an environment where families and caregivers can give feedback about services that they've had previously, how we can make sure that they are meeting the needs. And also really utilizing the Knowledge Hub to make sure that we're elevating best practices that are informed by families as well as lived experience. I'll talk a little bit more about that on a slide later as to how we're incorporating all of these voices. Next slide. Thank you. How we're valuing lived experience, both in behavioral health as well as in child welfare, but really looking at improved access to services. When we allow lived experience to be at the table, they're able to help us identify the barriers that exist and help us to provide strategies to ensure that we're able to engage youth, that we're able to particularly engage youth in an adoption competent manner in order to enhance services, not only accessibility, but effectiveness as well, including lived experience and trainings, allowing them to help support our strategic planning and sharing. Youth and adult partners, as well as fostering the justice, equity, diversity, and inclusion, which will really help strengthen the workforce ability to engage and support youth. We are really looking at utilizing contributions from individuals with lived experience and mental health systems to design and help to support the services, ensuring that they are holistic, person-centered, and effective. Really supporting an environment. We all know that mental health has some stigmas within our communities. So we're utilizing lived experience to help promote an environment where mental health is openly discussed and that we're able to destigmatize, contributing to a culture of acceptance and understanding within systems. We're able to integrate the voice of families in lots of different ways in the system. I really love this slide. I hope that you guys have the opportunity to go back and look at it later, really looking at each one of those places where we can use family and lived experience voice in order to help transform our systems. There are practical things on this slide where we can engage families in the process in order to make sure that our services are not just culturally responsive, but they're also accessible and that they are linguistically appropriate for the communities in which we serve. Having individuals at the table who have previously utilized services or are continuing to access services will help to inform how we get the services out to everybody who needs them. We have intentionally applied a racial and broader equity lens throughout the entire process of the National Center. We've looked early at the Knowledge Hub to make sure that the Knowledge Hub has topics within it that reflect the needs of underserved communities, that we highlight resources that are not only for underserved communities, but also by underserved communities. We are really intentional about increasing our reach with dissemination, making sure that we are advertising and reaching out to communities that are normally underheard, making sure that that we're building trust in communities who have traditionally been harmed by institutions. We're making sure that we are partnering with individuals that already have relationships within the community or were brought up within those communities in order to help us to be able to reach the right people. In addition, with our technical assistance, we're really engaging communities to come in and be at the table, helping us to do a comprehensive assessment that is available for sites to look at where are there systemic barriers, how do we encourage those who need the services to be able to access them, working with individual communities to hear from their family members and reduce all of these barriers. We're going to be using affinity groups as well as focus groups to determine where the site is in their assessment of cultural competence, where they are on the continuum, and then how we help to apply anti-oppressive and anti-racism work to their jurisdictions. I'm sorry, I don't know who comes after me.
Me.
It's
Thank
Erin.
you.
I'll hand it over to Erin. Thank
Yes.
you.
So, as we get into more about the technical assistance that the National Center can provide, we wanted to start off by sharing, we have the privilege of being able to speak to about 25 states so far, to really have a better understanding of what the barriers might be to accessible mental health services. So I just wanted, if you could put in the chat, what do you think? So we kind of have compiled some of the common themes or top barriers that we've heard to mental health services for our population, which again are children and youth and their families that have experienced child welfare. What do you think is kind of standing in the way of them accessing the mental health services that they need? Oops, I didn't mean to click that. Now I just gave you all the answers. Darn it. Maybe we've already talked to the state that you're from, but maybe not. And so this could be helpful information. We really tried to be as responsive to the needs, and you'll see that as we talk more about technical assistance. So the information you share will be very helpful. So lack of providers, adolescents aging out into homelessness, not enough providers, yep. And time and energy to follow through, yep. Funding, yes. You guys are so smart. You're really hitting it. Now I couldn't advance the slide. So yeah, these are some of the key issues that we have been hearing regularly in our conversations with states, tribes, and territories around the country. And I'm sure many of them are being experienced where you are or are no surprise to you. Services are fragmented. This is really why the National Center is focused on improving collaboration between systems, specifically between child welfare and mental health systems, so that the services can be offered more comprehensively, holistically. That speaks to the next point about the systems aren't collaborating. Those two kind of go hand in hand. Services not necessarily meeting the unique needs of a child, youth, or family. This is where the concept of adoption competence comes in, that providers need to have specific skill set and knowledge of what it is like for our children and families who experience child welfare. Child welfare tends to have an over-reliance on highest care levels, and we really want to get away from needing, emergency rooms or residential treatment centers to meet the needs of young people. We would love to be able to do it sooner so they can stay within their families. And like you all said, child welfare and mental health have a provider shortage, and the workforce that exists needs additional development. So thank you. Okay, we're going to get into types of technical assistance. So the National Center provides both universal and intensive technical assistance. Today, we are going to focus a little bit more on the intensive technical assistance piece, but I wanted to start off by just giving you all kind of a brief introduction about the universal, because that applies to anyone and everyone. Universal technical assistance is free and available. One of the main mechanisms is through the National Center website, and I'll put that link in the chat when I'm done talking. And we have the Knowledge Hub on our website, which has been referenced, but it is an online repository of information. And we have, I think we're up to maybe 400 resources right now, and it'll continue to grow in response to the information needs as we continue to learn about them. So it's a diverse group of resources, webinars, journal articles, tip sheets, all sorts of things, and they're available for, there's resources for parents and for both professionals in child welfare and mental health, as well as young people. And then we have a monthly e-newsletter, and when I wrap up things today, there will be an opportunity for, I'll tell you how to sign up for those so that you can receive the information. And then these webinars that we are on today. And then you can see, I'm not going to go over the intensive TA because Sean is going to do that here in just one moment. The most important piece I wanted to share with you about universal technical assistance, and I think you've heard me say this once or twice already, is while we are sharing information and disseminating knowledge and information, we learn just as much from hearing from all of you. And that's why we do things like webinars, we present at conferences and exhibit at conferences. It's a joy to be able to kind of directly interact with those of you who are doing the work day in and day out, because that helps us to be more effective in the assistance that we provide. So we also have, as Michelle had mentioned, are doing focus groups in each of the intensive TA sites that we are working in, so that we can hear directly from those who have received services or maybe have had some barriers in receiving services. I think another poll, 1 second. Let me launch the second poll. Are you seeing it?
Not yet.
Not yet. Okay. Why did it not let me? Oh, let me close out of this. Can you tell that I'm new to polls? Okay. That one has ended. I don't know why it's not letting me launch. Okay, well, for the sake of time, I'm not going to mess with that. But the question is, have you participated in our universal technical assistance? So for the sake of the poll not working, the options are, have you visited our website or the Knowledge Hub, attended a webinar? Check, you all have done that today. Have you received our newsletter or attended one of our conference presentations? Please share in the chat if you have any of those. So again, it's our website or the newsletter. Are you on our email list? That's the most important thing, so that you can stay connected to us. Keep on moving. All right, Sean, you're up.
Hello, everybody. So good morning, good afternoon from wherever you are. I'm a licensed clinical social worker by training and an implementation practitioner by practice. So my social work perspective is going to come in here right from the beginning. We, with our technical assistance, we meet a state, tribe, or territory where they're at. When we meet with the state, we meet with leaders across systems, and we develop a tailored implementation plan. So it's co-developed, and oftentimes it aligns with the work that's already being done in jurisdictions. So for instance, things like performance improvement plans, strategic plans, court mandated plans, et cetera. We don't want to reinvent the wheel, but if you need the wheel, we'll help you out. And you think on the mental health side, consider the role of value-based purchasing. So thinking about contracts and things like that, a few of our states are thinking about that with their managed care organizations. How do we incentivize the work that the National Center is doing where the money lies? And we consider multi-level engagement as central to our TA. So as I mentioned, working with managed care, working with high-level administrators, with providers on the ground, with families, as Michelle Seymore had mentioned too. So really bringing in folks. So everyone has a voice at the table, and our TA team will strategically select our our core team to really bring in subject matter experts from multiple areas. So from behavioral health, youth and family voice, child welfare, we have fiscal consultation that can happen, as well as tribal consults as well. So a lot of information goes into TA. So because we meet a state, tribe, or territory where they're at, we have to generally operate main principles. We have a framework to help focus our collective attention and channel our energy in the most impactful way. And this is our framework. So it's going to organize our time, our team, the activities we do in TA, and I'll go through each of these individually, and I'll sprinkle in some examples of what's actually happening with a couple of the states that we are working with currently. So the first part of our technical assistance framework is the innovation. So what is the thing that you want to implement or the thing that you want to change or install? So for the initiative, adoption competence, or what we'll call child welfare competent mental health services, is that thing. As we know, we also need to move beyond just capacity. So we want to be able to have families access to services and for systems to collaborate around such services. We know that children do better when adults collaborate. So in the states that we are currently underway with TA, there's different needs for this innovation. One state wanted to deepen its workforce in terms of what they have with child welfare and with the mental health sector as well. And another state we're working with has trauma-informed care across collaborative infrastructure, and they really want to deepen the dive on the impact with child welfare and child welfare providers. So 2 states comes from 2 different sets of needs for the innovation, but we can adapt and really kind of push that along and help them through that. So how do we help them through it? We have to phase our time. So we approach our TA in phases. So if you're familiar with implementation, this is the EPIS model. Knowing that we can't just do a cookie cutter type of template of a program, we want to be responsive to what it looks like on the ground with you. We listen in, we hear what's going on. We'll travel to your state, tribe, or territory as well to really get a lay of, literally the lay of the land of what it looks like. So knowing that we have a framework and we can make adjustments along the way. So we have these 4 stages of exploration, seeing what the need is. Let's meet, let's partner together and really define what does partnership mean. Preparation occurs, so we want to make sure we have the right folks at the table, that we're being intentional and thoughtful about all the different participants that we want, the reach, the scope, how we want to have the best impact with this TA. Our preparation phase leads into the co-creation of that TA work plan, which really is like our roadmap, or for anybody that's a therapist or child welfare direct service provider, right? It's like a treatment plan in a way. It's our plan to move forward. And then the implementation phase is where we're going to do the activities of that work plan. We are always going to be looking at sustainability. So thinking with the end in mind, we don't want to sign you up for something that we know that you can't sustain. So really working with you from that reverse engineering approach of what is it going to look like in 12 to 18 months? Is this feasible? Is it appropriate? And is it acceptable to you all? So the sustainability starts at the beginning, even though it's listed at the end, because we want to make sure our TA is going to end. So how do we set you guys up in terms of making sure that you can push forward with these changes and innovation? So knowing that this work doesn't happen on its own, there are drivers, and it only takes one person to start that conversation. So when we think about drivers, we think of things like barriers or facilitators or things that accelerate progress or things that can stall it. People are really central to this. So you can have a champion at the service system level, so a provider or a supervisor. When you think about folks in service systems, you could have a program champion in your mental health administration, in your family-run organizations. So we look to think about who are those key people. We want to think about, too, the strengths, weaknesses, opportunities, and threats that are evident in your service systems. So our business-minded folks, right, that's a SWOT analysis. And really that gives us the context of what do we need to consider when we're thinking about doing this work and setting up for sustainability. Okay, so mentioned too, it's always about people, right? People really drive the work. So we organize our TA into teams. So we have a steering team that would meet monthly. They're the folks that really steer what and direct the work. So coming up with scoping, what do we want this impact to be? What's the reach that we want or the penetration into a given system? So really kind of thinking, how do we develop this blueprint and really hold the charter for the TA work as we go through. Once a TA work plan is developed, we have an implementation team. So these are the folks that are more of the doers, the active folks where the rubber meets the road, essentially. And there's implementation work groups, knowing that there's different levels of expertise that can come into play. So making sure that we're really capitalizing on what strengths particular systems have, but also the people that are closest to the work as well. So the steering team would gather updates too, and it's just with steering, right? We'll direct the work if we need to make adjustments along the way, which leads us to the last part of our TA framework, which is improvement cycles. So when we think about improvement cycles, we want to think about things as they're happening in real time. We want to make sure that we make adjustments along the way, as opposed to waiting 180 days and realize that we were way off the mark. It's always harder to go back. So we want to implement small changes, see how they work, and make adjustments along the way. And this is where a lot of the data comes in. So it keeps a pulse on our efforts, and we can tailor any changes of what's happening on the ground. So example of improvement cycles. We had a recent kickoff event with one of our states. We just got the evaluation of that day. So we were able to see the feedback, and the feedback was so rich, and it gave us such great information about the particular training needs they have. They said, we really liked what you said about this. We need more about this topic. So they wanted more about NTI and the training itself. So that was a way for us to bring that into a steering team meeting and say, this is what folks at this meeting were looking for. How can we make sure this gets in and this is centered in the work? So you think across all of these things in our framework, we think of our phases, we think about our drivers, the teams, the improvement cycles, all coming together to really drive this technical assistance. So last thing too is related to, so who should be involved? Really anybody. But when we think about it, that idea of inclusivity, who needs to be here? Folks that have a stake in the welfare of children and families and the mental health of children and families. So Michelle Seymore had mentioned too, when we think about it from a racial equity lens, when we think about it from lived experience, are we making sure we're capturing the multiplicity of folks and their identities, the perspectives that they bring? Because that richness of perspective is really what's going to make things stick for us. So that's actually the last part of our technical assistance framework. I could talk about it for a very long time, but we signed up for an hour webinar. So appreciate your time and attention. And you have our contact information as well. And I'll turn it back over to my colleagues.
So how does all this pull together? What, everything that we've shared is going to pull together into a technical assistance plan. And so what we have done is we've pulled together some work that we're doing and really to look at what is a technical assistance plan. And the reason we share this is because we're continuing to look for states, tribes, and territories that are interested in our technical assistance services. And so I wanted to give you some indication on what this could look like in your state if you were to move forward. And so we talked about our goals earlier, and we talked about who all needs to be involved. And so this breaks down that into objectives and activities. And so our first goal is we want to create cross-systems collaborations to create an infrastructure that allows mental health and child welfare and everybody to be communicating. And the objective of this is to improve outcomes for children, youth, and families. And so as a result, we have worked with our states and they will help us prioritize the work and scope the work. When we started this, when we start developing plans, we often have 10 to 15 activities per goal that we have identified, and we simply can't achieve all those in 12 to 18 months. So we keep those, but we prioritize. And so through the work plan, some of the things that we might want to work on are to understand what current cross-system collaborations exist within the state, tribe, or territory. And these might include systems of care, task force, school programs, and how can they come together and be brought into TA to help with the achievement. We might want to bring together stakeholders to include those with lived experience, to have a governance committee and really develop the infrastructure for the work to continue beyond the period of TA. And then maybe we want to develop collaborative agreements and memorandums of understanding, or help identify funding sources that can support ongoing development of services, maybe shared braided funding or ways to seek outcomes for children, families. And then goal 2, as we move into it, we're going to look at improving access to adoption competent providers. So some of the things that we might be talking about is, where are your access areas? Do you have a lot of rural communities that simply don't have services because they're not there? We might want to ask you, what is your, we're going to ask you, what is your access concerns? And if you had that magic wand, what would that look like to have that? And so we might want to look at 3 new care pathways on getting children's services. And so what does that mean? What is a care pathway? Maybe it's involving the schools. Maybe it's involving a boys and girls club to help identify needs of children and ways that we can get services. We might want to use our affinity groups and surveys that we've done to really help understand barriers from the lived experience perspective. They're going to give us a different lens to see where the challenge areas are, and ideas that will help improve access to care. It might be that they're going to suggest that there are some non-traditional behavioral health care services available, such as peer professionals. And so we might want to put in the plan to pursue peer professional linkages and look at ways to fund those. And so those can be worked into a plan. We're going to maybe want a directory for people to be able to find services. And so we can help states with figuring out what such a directory will look like, a directory of adoption competent providers, so that when a family is involved in, maybe they have adopted and they're seeking some services post-adoption, maybe we could help develop a directory that those families could go to and find those providers that have an understanding of the needs of children that have been involved in child welfare. Erin, I'm ready for that. Thank you. So then the goal 3 that we're also going to be looking at is increasing skills and competencies of the workforce. And so some strategies that might be is, how do we involve the Office of Juvenile Justice? How do we bring in managed care organizations? How do we bring in lived experience? One of the activities or tasks that we might want to accomplish is to partner with payers, such as managed care, to identify strategies that can help them incentivize completion. And we know it's a very long training, and clinicians have billable hours that they have to achieve. And so we want to strategize ways that make that achievable. We might want to bring in financial consultants to figure out how we support ongoing training. or develop that expanded definition of providers. Who are they going to be? Could schools play a part, youth organizations, and get them to participate in the NTI training? And then another activity may be to partner and make referrals so that each agency or organization that's involved in the TA work commits to training 3 clinicians or 3 staff members per year. And so then we can expand upon that. So as Sean starts, sometimes we're going to start small and we just want 3 clinicians per organization, or if it's a small organization, maybe just 1. But ways that we can begin to infuse that adoption knowledge and then have it grow and beyond. And so just wanted to kind of make this real for you through what a plan could look like. And so I know that many of you may not be involved in decision-making opportunities, but as Sean said, every voice matters. And so if you can carry this and know that this opportunity is available to your state, to your tribe, to your jurisdiction, then you can pass that information along. And then throughout all of this, I think this is me, Erin, still right? Throughout all of this, sustainability has to be a focus of the technical assistance. How can we make sure that beyond our 12 to 18 months of working with people, that the work is going to continue and that the training is embedded into the state system, that adoption competence is a priority for providers working with children, youth, and families that have been or impacted by the child welfare system. How can we make sure that training of mental health providers is maintained and that the training is available? We want to also think about those collaborative structures and what does data collection and shared data look like? And I know that that's often a huge problem to overcome, is that sharing of data. And so we can think about that, and we can strategize ways to improve that. And then also ongoing funding. Are there funding streams that might be out there that we can definitely access to help continue? So throughout all of this, we want to celebrate the progress that's made and showcase and really see the work that is being done, because we know you're doing it daily. And we want to come and help support and partner with you to align with your efforts and really help you achieve those outcomes. So we talked about adoption competency training. Some of you from the poll already know about it. Those of you that don't, it is free, web-based, and there are continuing education that goes along with it that is also free, and really does provide a wealth of information, even for the most experienced clinicians or child welfare staff. I always tell people I worked in child welfare for many years before I took this, and it enhanced my knowledge and really helped me to understand what I didn't know and how to meet the needs of the children involved in child welfare. So that there is a link, and when you get this webinar, you'll be able to click on that link and it will take you right to the training. Oh, and Erin put it in the chat as well, so you don't have to wait for the PowerPoint. So why is NTI important? Well, it's important because 92% of mental health participants indicate they develop new skills, just like I shared. After many years of working in child welfare, I absolutely developed new skills and knowledge. And 96% of those taking it think it will enhance their effectiveness in their work with children and families. That's very, very significant. Throughout the 10 modules, anything over 90% effectiveness is absolutely something to celebrate. So why you should consider it? I think that, you know, as we continue to see, somebody mentioned that our old practices don't work for our children. That's absolutely true. And this training can help us build practices that will work for children because we're seeing them through a different lens. We're seeing their behaviors as adaptive strategies, rather than as behaviors or mental health issues. And through this training, it really helps us support the youth as they deal with these losses that many people don't even understand, ambiguous loss or disenfranchised grief that these youth and these children experience daily. So I think that if you want to improve mental health populations for this outcome, this training will help. If you're providing services that aren't effective and you want to have better results, I think this training can help. And ultimately, we can see a lifelong impact when we're meeting the needs of our children. Everybody knows about ACEs, and we know that if we don't intervene, then it will continue lifelong into adulthood. And so I don't want to spend a lot of time. I know we're at 150, but you can see we've talked a lot about the benefits. And I really think that through this technical assistance, not only can we help with the training and competency of providers, but we can really help with access and making sure that we're collaborating and all working together to achieve good outcomes for children, youth, and families. So thank you.
Thank you, Michelle. Let me go to the, hopefully this video will work. Michelle Seymore, did you want to introduce this at all or just let's play it?
Let's play it.
Got it. Okay. You've heard this from Sean and from Michelle Savieo. It only takes one person to start the conversation.
So ladies and gentlemen, at TED, we talk a lot about leadership and how to make a movement. So let's watch a movement happen start to finish in under 3 minutes and dissect some lessons from it. First, of course, you know, a leader needs the guts to stand out and be ridiculed. But what he's doing is so easy to follow. So here's his first follower with a crucial role. He's going to show everyone else how to follow. Now notice that the leader embraces him as an equal. So now it's not about the leader anymore. It's about them, plural. Now there he is calling to his friends. Now if you notice that the first follower is actually an underestimated form of leadership in itself. It takes guts to stand out like that. The first follower is what transforms a lone nut into a leader. And here comes a second follower. Now it's not a lone nut, it's not two nuts, 3 is a crowd, and the crowd is news. So a movement must be public. It's important to show not just the leader, but the followers, because you find that new followers emulate the followers, not the leader. Now here come 2 more people, and immediately after, 3 more people. Now we've got momentum. This is the tipping point. Now we've got a movement. So notice that as more people join in, it's less risky. So those that were sitting on the fence before now have no reason not to. They won't stand out. They won't be ridiculed, but they will be part of the in crowd if they hurry. So over the next minute, you'll see all of the those that prefer to stick with the crowd because eventually they would be ridiculed for not joining in. And that's how you make a movement. But let's recap some lessons from this. So first, if you are the type, like the shirtless dancing guy, that is standing alone, remember the importance of nurturing your first few followers as equals. So it's clearly about the movement, not you. Okay, but we might have missed the real lesson here. The biggest lesson, if you noticed, did you catch it? Is that leadership is over-glorified. That yes, it was the shirtless guy was first, and he'll get all the credit. But it was really the first follower that transformed the lone nut into a leader. So as we're told that we should all be leaders, that would be really ineffective. If you really care about starting a movement, have the courage to follow and show others how to follow. And when you find a lone nut doing something great, have the guts to be the first one to stand up and join in. And what a perfect place to do that, TED. Thanks.
I really love this short video, and this is our way of asking you guys where you fall on this continuum and how you help us turn this into a movement as we're kind of the lone nuts out here that are doing our little dance and running around singing our song. But if you can jump on board with us and help to bring the rest of your team on, we can make this a movement and change the lives of children all over the country, create a system that is equitable and accessible, creating environments where children thrive and families are able to stay together, really working with us to help build the bridges between mental health and child welfare.
Thank you. Well said, Michelle. Oh, okay. So, we have about 5 minutes. I did put the link, in the chat for our survey. If you would take a few minutes as we're wrapping up to please provide us some feedback. We have found that it's better if people complete it during the end of the webinar. So please do. It is a real quick survey. Please do submit your feedback. As I think you have kind of picked up on throughout the webinar, we are always happy to receive that real-time feedback to help us improve. But let's multitask a little bit. Does anyone have any questions? And if you do, please feel free to put that in the chat. And we have a few moments to answer some questions. And while you're doing that, we're just all about the multitasking. Here's the slide where you can go to our website, and I put the link in the chat, bridgesformentalhealth.org. And on the website, there is a form you can fill out. It's called Connect with Us, and that's how you sign up for our newsletter, our email list. And we are regularly creating new content on a variety of topics related to child welfare and to mental health. And being on our email list is the best way to stay on top of the new content and resources that we have to share. If you want to be that one person who starts the movement, you can reach out to our National Center Directory, Mary, not directory, Mary, to start a conversation about possibly bringing intensive technical assistance to your area. Okay, we have a question. Did any entity in Arizona? I know we've talked to a lot of states, and each state is kind of in a different stage, but have we had conversations with Arizona yet, Michelle, Savieo?
We've had some awareness building in Arizona, but not any in-depth conversations. And so Nancy, if you would like, or you know some people who in Arizona that we need to get in touch with, we'd love to hear from you and share that information. So I know Mary, her email is on here through our website. There's also a contact us site. We would love to hear more, and but at this point in time, we do not have anything happening in Arizona. Would love to though.
I'm going to put Michelle's in the chat too. Any other questions? Oh, those didn't become links for some reason. Just one last plug as we're wrapping up for the survey. Please, you can even scan the QR code or click the link that I put in the chat. And I think if there's no more questions, we'll wrap up. So long as you completed the survey, we'll leave the webinar live for another minute or two in case anyone does have additional questions. Otherwise, thank you very much for joining us today. And please stay tuned. We'll have a new webinar every month.